Children's is a very special place. There aren't that many children's hospitals in the country or in the world for that matter. They are a very special entity.
As a parent, you want to know what's wrong with your baby. You want to be able to do something to help. You want to be able to provide the right medical therapy and providers and get the right team involved. As a physician, it's so important to get it right early so that you can make a difference in outcome. The Children's NICU is the only level 4 NICU in the region. And what that means is that we have all the other capabilities of other NICUs in the region, but we are the only place where every medical subspecialty is available and every surgical subspecialty is available. The complexity of our patients can only be taken care of here. In the past, I think people have equated babies with small size and need for small size in rooms and small size in facility, but that isn't necessarily true. We need bigger rooms, we need room for families, we need accommodations for parents, and we need to be closer to every facility over at Children's. It's a critical need.
Children's new expansion plan is important because it includes a new newborn intensive care unit to meet the needs of our most fragile newborns and their families, as well as a larger pediatric intensive care unit to accommodate our growth in critical care, fueled in part by our expanding Dr. C.C. and Mabel L. Chris Heart Center.
A lot of our patients are extremely sick, and so a good percentage of what we do as cardiologists and cardiac surgeons is in the intensive care nursery and in the pediatric intensive care unit. As we have done more and more for our patients and gotten more and more complex with what we do, the intensive care requirements are very large.
Children's is growing dramatically, both in the number of patients served and the variety of medical services we provide. Expansion will give us the facilities we need to care for all of our patients, enabling us to give quality care to all children, including children like Maddie.
My daughter Maddie has cystic fibrosis. She's 7 years old, and she was admitted to the NICU at Children's Hospital and Medical Center when she was just a few days old. When we found out she had cystic fibrosis, I really couldn't think, I didn't know exactly what that was. And so it was very scary to know that she had a genetic disease. And so the doctors who came in, they just explained everything to us, and you know, we went from there. Draw over those lines again, maybe. Okay.
Or maybe.
Cystic fibrosis is a medical condition that requires daily chest percussion treatments and medication in order for CF patients to thrive. Right now, the median age is about 38, and so we're hoping to see that rise, and we're hoping for a cure. Maddie has used many services at Children's Hospital and Medical Center, including the ER, radiology, endocrinology, the surgery center, as well as the regional Nebraska Cystic Fibrosis Center. Well, as she gets older, our relationship with Children's has changed somewhat in that what I think is really fun is they've been able to see her grow and you know, turn into this bright, bubbly little girl. To have that continued care with the same doctors and nurses is really important to me, so that they know what's best for her as she gets older. I think most parents, when they have their children, they don't know yet that they might need services from Children's. It's very important to make sure that the facilities and just the place that they go to are the best possible for Omaha and Nebraska and the surrounding area.
And then I can stay on a
Financial support from the community has been essential to children since our first hospital opened in 1948. It is just as important today as we look forward to our upcoming expansion project so that we can continue to provide the best care for the kids in our community, in our region, and across the country.
For people to come to Omaha and say, I go because I go to the Children's Hospital, because I know their cardiac surgical program is the best, and my baby has a really complicated heart condition that not many places can take care of. That to me is, and that to many, I think, should be a reason that you would want to have your emotions attached to have your financial support attached to have your legacy attached to. I think people who are part of an effort that we hope will be one of greatness at Children's, I think can relish in the thought that, gee, look at how I helped do this. The survival of that little baby is in part related to my generosity or my forward thinking.